Welcome, everyone. We will give people a few minutes to join. We are glad you're here. Thank you so much. Good afternoon. Thank you for joining us today. We are starting in a minute or two. We're letting people join in, and we will be with you shortly. Good afternoon. We're going to go ahead and get started. We have others who will join us, so thank you so much for joining us today. My name is Sophia Pertus, and I serve as Senior Advisor at the Jed Foundation. I want to welcome you to today's webinar, Introducing the Proud and Thriving Framework to Support the Mental Health and Well-Being of LGBTQ+ students. This was made possible by a generous support of the Upswing Fund for Adolescent Health and numerous supporters at Jed and beyond, some of whom you will meet during this webinar. Please check out the Proud and Thriving website, which we'll add to the chat in a little bit so that you can read our literature reviews and our published announcements from June during Pride Month. So thank you so much. We're excited to share that the final Proud and Thriving framework will be ready later this month, and we will send out notes to all of our subscribers, and it will be on our website and social media channels. Today, we're proud to share highlights from our research findings and our recommendations for what individuals and schools can do to support LGBTQ+ young adults in high school and colleges and universities. Before we begin, we want to share a few administrative items. First, we would like to point out that the information provided in this webinar is not intended to be a substitute for or to be relied upon as medical advice, diagnoses, or treatment, nor is it intended to be a substitute for or to be relied upon as legal advice or counsel. This webinar is being presented for informational purposes only. Thank you for joining us. Two, if you need closed captioning services at this point, you can click on that feature. I'm going to be putting it on now. For live transcripts, so feel free to use that feature for accessibility. Thank you. Third, this webinar will be recorded. A link to the recording will be made available on the Jed Foundation website. Finally, if you have any questions, please type it into the question box on your dashboard. We will do our best to answer your questions during the Q&A at the end of today's presentation. If we're not able to answer your question, please send the note to info@jedfoundation.org, and we will do our best to answer your question. For those of you unfamiliar with the Jed Foundation, Jed is a nonprofit organization that protects the emotional health and prevents suicide for our nation's teens and young adults, giving them the skills and support they need to thrive today and tomorrow. We partner with schools, high schools, and colleges to strengthen mental health, substance misuse, and suicide prevention programs and systems. We equip teens and young adults to navigate mental health challenges, to seek and give help, and to be emotionally prepared to enter adulthood and fulfill their potential. We also educate communities to support the emotional well-being and mental health of our nation's teen and young adults. We would like to express a special thank you to the Upswing Fund for Adolescent Mental Health for their support of the Proud and Thriving Project. So far, we have been able to produce 2 literature reviews that you can already download right now at the Jed Foundation website, jedfoundation.org. Later this month, we'll publish our final report and framework. Watch for announcements on our social media channels and on the Jed Foundation website. You will see that there are 2 literature reviews. One is exploring mental health considerations for LGBTQ+ students, and we also have one for exploring the mental health of trans and non-binary students. Today, I'm joined by a panel of our esteemed colleagues who have contributed to this important project and will share highlights about the importance, the research findings, and most importantly, our recommendations for how individuals, mental health providers, and schools can support LGBTQ+ students. I'll start with myself. I introduced myself, but I'm Senior Advisor for the Jed Foundation, and my pronouns are she, her, hers. I also have here my colleague, John Dunkel, whose pronouns are he, him, his, Senior Director for Knowledge and Advising for the Jed Foundation. Also my colleague at Jed, Emily Bader, who is a high school advisor. Her pronouns are she, her, hers, and We also have here a few people that we want to thank who contributed to this amazing project. First of all, we have Dr. Angela Batista, CEO of Batista Consulting Services. Her pronouns are she, her, hers. We have Dr. Marin Greyhouse, who is the Senior Director of Diversity, Inclusion, and Belonging at Harvard University. She has she, her, hers pronouns. And finally, last but not least, of our contributors, external contributors to JED, Dr. Reese Kelly, CEO of Embodied Values, who goes by he, him, his pronouns. We also have the Consortium of Higher Education LGBT Resource Professionals who have been instrumental in really getting this work going and have been so helpful with providing their feedback. First, we have Chris Woods, Director of the NYU LGBTQ+ Center within the Office of Global Inclusion, Diversity, and Strategic Innovation and Consortium of Higher Education LGBT Resource Professional, previous coordinator. We have the current external coordinator, Jessie Beal, who is the director of the Gender and Sexuality Campus Center at Michigan State University and goes by they, them pronouns. I hope I got everybody's pronouns, and we will do some really quick intros later. I would be remiss if I did not mention that there were numerous other internal and external contributors to this project who we are so grateful for sharing their input and expertise, including the Trevor Project's Dr. Amy Green, who was really helpful as we prepared to do the research for this project. All of our contributors are listed in the Proud and Thriving report and framework, and actually they're also in the literature reviews that we've already published on our website. So a few learning objectives for today. Participants will learn about risk factors that exist for protecting emotional health and preventing suicide for LGBTQ+ high school and college students. Also protective factors. We will also share our research findings and recommendations that were generated from our comprehensive research on LGBTQ+ youth. So we've already done introductions. We're going to do a project overview, framework development process. What brought the project forward? How did we get it together to accomplish it? And also, what were some of the overview and highlights from the research? We can't possibly do that in less than an hour, but we'll do our best to share some of the highlights. We're also going to share the highlights from the recommendations. And at the end, if we have time, we will try our best to answer some questions for you. So why did we even begin this process? When I joined JED in 2018, we had just published the Equity and Mental Health Framework. And I was really intrigued by the idea that we had created with the Steve Fund a way for colleges and universities to think about how they may provide better support systems for students of color. So it got me thinking, can we do the same for LGBTQ+ students, knowing that there's a lot of intersectional identities that we also need to consider when we think about what that means. So I was excited to get support right from day one and had many folks, like I said, who joined the conversation and were really helpful with thinking through what is it that we need to do? How can we look at what other organizations like the Trevor Project and others have done to really help highlight some of the unique challenges, but also some of the unique support systems that we could be talking about. So I want to talk to some of our colleagues here from the Consortium for Higher Education LGBT Resource Professionals. And the question for them is, why did you think it was important to support this project and the Jed Foundation when we approached you and said, would this be something that you can work with us on?
Thanks so much, Sophia. Just a quick note, I noticed in the chat that there's a comment about closed captioning. I don't know if, I think it might not be on right now. So just wanted to note that. So just a quick introduction, y'all. I'm Chris Woods. I use he, him, his pronouns. I in my day job, serve as the director of the LGBTQ+ Center at New York University, and had the pleasure of being on the Consortium of Higher Education LGBT Resource Professionals executive board as one of the coordinators. I'm going to turn over to Jessie to introduce themselves.
Hi, folks. My name is Jessie Beal. I use they, them pronouns. I'm the director of the Gender and Sexuality Campus Center at Michigan State University. I am actually about to move to the University of Michigan Spectrum Center as their associate director. I'm very glad to be here today with all of you. I actually have to handle a little bit of an emergency with my LGBTQA plus teenagers. So, Chris, if you could talk a little bit about the consortium while I answer them. Working from home, it's a dream come true. So give me just one moment.
I totally can do that. Yeah, so for those who don't know about the Consortium of Higher Education LGBT Resource Professionals is a member-based organization that's really working towards the liberation of LGBTQ plus people in a higher education context. So we support those who work in higher education institutions across the country and across the globe to better support people of diverse genders and sexualities through things like educational initiatives, webinars, best practice documents, policy recommendations, things like that, and with various resources to do more LGBTQ plus intersectional and racial justice centered LGBTQ plus work. And so, when we were approached by the Jed Foundation to partner on this project, we were so excited to have been in partnership or been invited to be in partnership with Jed. Because we obviously care about the well-being and mental health of our LGBTQ plus students. And although our mission is focused on the higher education context, it was really incredibly valuable to us to partner on a framework that really imagined our LGBTQ plus students from high school all the way through colleges, through their time in college. And so I also wanted to add that our LGBTQ plus youth are coming out at younger and younger or earlier and earlier ages. And our current young people live in a generation where they're really rethinking the ways in which gender and sexuality can be imagined, and really thinking about gender and sexuality in more expansive ways than many of us may have even experienced in our upbringing. And so we hope that this framework will equip you with the skills, the research, the data, and recommendations that can help you better support LGBTQ plus students and questioning students on your campuses, in your high schools. And if nothing else, hopefully spark a conversation in your schools with your leadership and with your colleagues to better support these students. We don't see this as the end, but just the beginning and a resource to help you guide you in your work. So just thank you to Jed for all of your support and your partnership. Yeah.
Thank you so much for that, Chris. I really appreciate that you said this is the beginning of a conversation, because as we know, we have seen so much new information, and the ways that we identify ourselves, the language available to us when we were younger versus now and in the future is always going to evolve. So that's why you'll see later, I'll give a preview, spoiler alert, that some of it is keeping that education going and continuing the conversation so that we can support each other and not pretend we can know everything and it stops. We have to accept that we're always going to be changing our language and thinking about this in different ways as context changes around us, right? We have to be responsive. So do you have, Chris or Jessie, do either of you have any final thoughts about how the consortium could be a resource to folks? And is there anything else that you think we should know?
Sure, I'm happy to take this one. One of the things that I love the most about the consortium is that it's people who are on the ground in campuses doing the work, talking to students, right? So we issue policy and practice guides. We tend to be a professional home away from home for folks who work all on campuses all over the place, right? So often folks in jobs like ours are offices of 1, 2, 3. So where do we go when we need support? Because care work is incredibly hard, and we're supporting a population that this study demonstrates has a high level of need, right, for support and resources. So where do the caregivers go? And I think for me, the Consortium of Higher Education LGBT Resource Professionals is where I go for both professional support, for standards of practice, but also for community, right? So that my well is full so I can help others. Chris, would you add anything to that?
That was beautiful.
Thanks. Mm-hmm. And I apologize for having to step away.
No need to apologize. We are living in real times where grace and openness is part of the deal, right? So thank you so much. I'm so appreciative of you both and for the whole consortium and other members of the consortium who have contributed to this work. I will now turn my attention to an important member and contributor to this project. We had Dr. Angela Batista join us back in the beginning of this year in March, or even a little before that. And she has been instrumental in keeping us on track as our project manager and really helping us think through the big picture, the little picture, the details. So I'd love to hear from you, Dr. Batista. Angela, how did we get here? What are some things that you think should be highlighted with the way we all came together to make this happen, to create this framework?
Thank you, Sophia. I'm very excited to be here today. Hello, everybody. I use she, her pronouns. And as shared, I am the founder and CEO of Batista Consulting Services, but I actually have a lot of experience. I've worked in education for almost 30 years, and I'm the formal BPSA, or VP of Student Affairs and Institutional Diversity and Inclusion at Champlain College. So, I currently serve as a subject matter expert for JED, and I was so excited when Sophia asked me to work in this project. As you know, I identify as queer, and for me, it was really important to find a way to give back. I also have a lot of experience serving LGBTQ plus students, and I know that this work is so critical. So I'm incredibly humbled to be part of this amazing group of people that have made this together. So what I'm going to do in the next 2 or 3 minutes is give you a very quick sort of synopsis of how we got here, so that you can understand. We've had lots of ups and downs, but it's been an amazing journey. So the seed for this project was actually born in 2019 as part of a collaboration between JED leaders and the Tyler Clementi Center at Rutgers University. Hope we have some of Rutgers colleagues on the call. And then that center was erected by our own Marin Greyhouse, who's here on our call and our colleague in this project. And when Marin transitioned from her director role, she became a subject matter expert at JED and continued to partner on this project. Eventually, as you've heard, a decision was made to pursue the development of a new framework focused on how to best serve LGBTQ plus students in partnership with the LGBT Consortium. The model for this framework was previously published, the Equitable Mental Health Framework, which was funded by the Steve Fund and led by Sophia Pertus, who you already met. In 2020, internal and external funding options were pursued, and ultimately, as Sophia shared, JED secured a grant from the Upswing Fund for mental health for the project, and we again thank them. It's been instrumental in helping us do this work. In early 2021, I joined to coordinate the project and an expanded interdisciplinary team of JED subject matter experts, as well as consortium leaders and volunteers who came together to launch the actual research process. Around this time, we also invited Dr. Luis Kelly, who you met earlier, to join, and together with Marin Greyhouse, he co-authored 2 significant lit reviews that were mentioned early, and so you can find those on the website. I will put the link on the chat so that you can see it if you haven't seen it. Over the last few months, we have achieved a great deal to get to this point. We conducted focus groups with administrators and staff, and that included non-teaching staff, mental health providers, social workers, guidance counselors. We also included LGBTQ plus students and allies, GSA members at high schools, faculty and teachers, and of course, members of the Consortium of Higher Education, LGBT resource professionals who really helped us carry this project forward. We also contracted with the firm Decision Analyst to conduct a survey of a national sample of LGBTQ plus youth, and you'll be hearing about those findings shortly. We also looked at data collected from JED partner schools through the Healthy Mind survey, and we analyzed that data to identify related themes. With Reese's leadership, all the findings were summarized and recommendations identified, and this is what makes the core of our framework. The project is currently in final design stage, as Sophia said, and it's expected to be published broadly later this month. I just want to take 30 seconds to say there are a lot more people than just the people that are on stage today that were involved in this project. Thank you so much to all of those that helped us get here, including the Jed Foundation leaders and staff, volunteers from the consortiums, and the other volunteers who helped us along the way. A special shout out to Reese, who did an outstanding job writing the content of the framework. And of course to Sophia for her leadership and commitment, and for the opportunity to be involved in such incredibly important work. Thank you so much. I'm going to turn it back to you, Sophia.
Thank you so much. We really appreciate your contributions, and I echo all of the different thanks. So I'm going to be turning it over to some of our other colleagues who have really contributed to this work. And I'm going to start with Dr. Marin Greyhouse, who's going to go over some of the research. You're probably curious, what did we find? What were some of the foundational data points that led us here to think about why we needed the research. So after Marin, we're going to hear from Dr. Reese Kelly, who did, like Angela said, an amazing job of synthesizing and bringing together lots of different data points. And we'll cover that in a bit, but we'll start with what were the risk factors that we found. And I'm going to turn it at this point over to Dr. Marin Greyhouse.
Hello, everyone. Thank you all so much for being here today. We're so excited to be presenting the product of 2 years of work. And so thank you all for coming and joining us today. So before we get started, I just want to talk about what risk factors and protective factors are. So risk factors are those sort of behaviors, environmental aspects, and interpersonal dynamics that contribute to negative mental health outcomes. Protective factors are those that contribute to, or mitigate, I should say, negative mental health outcomes. So first we're going to look at risk factors, and then we're going to look at protective factors. So slide. So the individual risk factors that affect LGBTQ plus students sort of differ based on whether a student is queer identified or trans identified. So what we did is, in looking at the risk factors, we did 2 literature reviews because the issues affecting these student populations are so fundamentally different. So you'll see on these slides that we've split out queer and questioning students from trans and non-binary students. So some of the individual risk factors for queer and questioning students are things like internalized heterosexism and or monosexism, and monosexism being sort of sexism towards folks who are bi, pan, and whatnot. So the second individual risk factor that we found was identity concealment, or perceptions that one cannot disclose an identity. Third was burdensomeness and thwarted belonging. So burdensomeness is feeling that you are a burden on those, that you consider to be loved ones or part of your support network. And thwarted belongingness is that feeling of not, feeling that there's an intentional kind of action towards an LGBTQ plus youth that they cannot belong in a setting. So it's like intentional actions to mitigate belonging. So for trans and non-binary students, we have things like internalized cissexism, as well as a lack of identity pride, investment in things like passing as cisgender, social isolation, and shame. I just noticed in the chat that folks are having a bit of trouble with my audio, so I'm going to switch to my headset just to be on the safe side. Bear with me one moment. Hopefully this is better for folks. Can folks hear me? Okay, great. So moving on to the next slide. When we look at, individual risk factors, we then move on to interpersonal risk factors and then on to structural risk factors. So in terms of interpersonal risk factors, all LGBTQ plus students have risk for negative mental health outcomes because of unsupportive social networks and rejection from their, peers, family and caregivers, faith communities, teachers and faculty, staff and administrators. Secondly is interpersonal victimization, including things like bullying, harassment, physical assault, and sexual violence. So, having a negative, social environment has a tremendous impact on mental health outcomes. And then the third are the structural risk factors. So for queer and questioning students specifically, policies that don't enumerate sexual orientation around anti-bullying and anti-harassment is a risk factor. And for trans and non-binary students, the same thing, so non-discrimination and anti-harassment bullying policies that don't include gender identity or expression are a risk factor. Gender segregated facilities like locker rooms and restrooms, and sex segregated housing in residence halls is another risk factor. and an inability to put chosen names and pronouns into student information. Students are a third risk factor. But then among all LGBTQ plus students, some of the risk factors include lack of clear processes for reporting, responding to, and remediating victimization. So having a lack of bias reporting processes have a huge impact on mental health outcomes. LGBTQ self-identification excluded from surveys and institutional data. So, that spans from, your admissions paperwork to intake surveys in mental health offices on campus to, everyday things like our student ID cards and, information that goes to class rosters for, students' academic work. There is targeting and inequitable enforcement of disciplinary policies and practices. We see this across, multiple aspects of identity, but particularly LGBTQ students are vulnerable to being targeted by disciplinary policies and practices that disproportionately target them. Lack of resources for student services that address their needs and experience are a huge issue. LGBTQ offices make up about 10%, are represented on about 10% of colleges and university campuses in the United States. So that leaves about 90% of colleges and universities that don't have a paid LGBTQ staff person, either half-time or full-time, or a full-time graduate assistant. Lastly, the barriers to, a structural risk factor are barriers to academic engagement. So that can be everything from being excluded from curriculum to invisibility in the classroom or interpersonal violence among peers. Now let's look at protective factors. So again, protective factors are those factors that mitigate, the potential for negative mental health outcomes. So protective factors on the individual level include things like self-compassion, cognitive flexibility, bicultural and multicultural self-efficacy. And that's particularly important for students who hold multiple marginalized identities. For trans and non-binary students, it's self-efficacy along with proactive agency, body image, and congruence. And lastly, all LGBTQ students benefit from positive identity development and integration, which is tremendously helped by having paid LGBTQ professionals on campus to facilitate that process, along with self-esteem and identity disclosure. Now, I say that with the caveat that identity disclosure is complicated. Not all students can come out in every setting. And so we need to be sensitive to the fact that while disclosure is a protective factor, it's also a risk factor for some students in certain contexts. So moving on to interpersonal protective factors, for trans and non-binary students, having a sense of community is incredibly important. These are small populations on college campuses, and so we need to be really thoughtful about how we connect trans and non-binary students to each other and to trans and non-binary affirming communities. As well, and this sort of goes along the same line, there are a lack of trans and non-binary role models and mentors in our schools and colleges and universities. And so it's so important that employers, in our schools and institutions really look at, the role of hiring and empowering trans and non-binary folks to be in positions of influence. For all LGBT students, we have things like, having affirming social support networks, including peers, family, mentors, and faith communities, as well as having positive relationships with peers, both queer and trans and non-queer and trans, and finding that community connectedness among their peer group. In terms of structural protective factors, so sort of akin to the structural risk factors, enumerating sexual orientation and non-discrimination and anti-harassment policies, along with gender identity and expression, are beneficial for queer students and trans and non-binary students. As well, there are additional sort of structural protective factors that benefit trans and non-binary students, including gender inclusive information system on campus, athletic teams, and facilities, so restrooms, locker rooms, and campus housing. For all LGBTQ plus students, structural protective factors include clear processes for reporting, responding to, and remediating victimization. So having a really strong bias response protocol is critical. Having school-wide positive and restorative disciplinary practices, collecting things like chosen name, pronouns, gender identity, and sexual orientation on things like surveys, enrollment data, and institutional data are so critical, because if we don't see ourselves represented in the data, we can't do anything to serve our populations. And we are invisibilized when we're not asked those questions. So it's so important that we have those demographic indicators and we have those opportunities for folks to fill in their name and pronouns so that we can appropriately attribute name on things like class rosters and student ID cards. So providing LGBT-focused training and education is, pretty self-explanatory, but really critical, because if we don't improve the cultural literacy amongst peers, teachers and faculty, staff and coaches, administrators, board members, alumni, you name it, we cannot create an affirming climate for queer and trans students. Again, LGBTQ focused services are critical in the academic setting, the residential setting, the co-curricular setting in general. And so having professional staff from folks like folks from the consortium to serve in that capacity on your campus or in your school have a huge impact on mental health outcomes. And then lastly, when we look at clinical support, having culturally competent case management, health services, counseling services, and sexual violence prevention are a huge protective factor in addressing the needs of LGBTQ plus students. And so that really sort of sums up what our research found on all of those risks and protective factors. It's it's not an exhaustive list, but it provides some insight into some of those factors that influence student mental health outcomes.
Thank you so much for that. As you can see, that was the foundation for some of the work that brought us to our research. So I'm going to turn it right over to Dr. Reese-Kelly to go over what were the findings from our own surveys, focus groups, and HMS data analysis.
Thank you so much, and hi everyone. My name is Reese-Kelly. I use he, him, his pronouns. I'm also a queer trans man and have my PhD in sociology, which lends itself well to this kind of research, as well as my 20 plus years in higher education as faculty member, scholar, researcher, and administrator. And I want to present an overview of the findings. I think when the framework comes out, it is in your best interest to also see the greater description in detail and more fine information in there than what we're able to provide in this webinar. The findings from the Proud and Thriving survey, the Proud and Thriving focus groups, and the Healthy Minds survey complement and supplement existing research that Marin was giving the highlights of. And this research demonstrates that there are notable mental health disparities between LGBTQ plus high school, college, and university students and their heterosexual and or cisgender counterparts. In some instances, these disparities are even greater when it comes to LGBTQ plus BIPOC students, Black, Indigenous, and people of color students, as well as trans and non-binary students. It's also important to think of additional things like educational outcomes, absenteeism, retention, and completion. All these things are correlated with students' mental health rates, which means that the factors contributing to LGBTQ plus students' higher rates of mental health issues are the same factors contributing to the inequitable educational experiences that our LGBTQ students in secondary and higher education settings are experiencing. So let's go to the next slide of what it looks like. When we're looking at the mental health of LGBTQ plus students from the vantage points of the 3 different research studies that we did, we found that LGBTQ plus students self-reported lower levels of happiness, confidence, self-worth, and optimism than their cisgender and heterosexual peers. They were also more likely to experience or be diagnosed with anxiety, depression, ADHD, an eating disorder, PTSD, a personality disorder, and autism spectrum disorder and or a substance use disorder. LGBTQ plus students also experienced greater incidences of negative experiences compared to their non-LGBTQ plus counterparts. And these include pressure to conform to gender norms and pressure to be someone that they're not. It was no surprise to us that LGBTQ plus students also reported higher rates of coping and maladaptive behaviors compared to their peers. The largest difference that we found was across self-reported thoughts of self-harm, which includes things like cutting or burning. And the gap was huge. 41% of LGBTQ plus high school, college, and university students that we surveyed self-reported these experiences as compared to only 16% of non-LGBTQ plus students. Next slide, please. We see a consistent theme of higher rates of coping and maladaptive behaviors for LGBTQ plus students of their self-reported experiences in the survey compared to non-LGBTQ plus students. This first slide is around just looking at drugs and alcohol. The ones that are asterisks are the ones that are statistically significant, but the gaps are there respective of the significance indeed. Let's go to the next slide, please. The one on self-harm is the one where we saw, again, the greatest gap in those percentages and the differences. But this is also a slide where there's statistical significance at every single measurement of coping and maladaptive behaviors around self-harm, from thinking about cutting yourself or hurting yourself to thoughts of suicide to attempted suicide, with 5 times the rate for LGBTQ plus students as compared to their non-LGBTQ plus peers. When we look at the survey data, it also shows us the top concerns. Yeah, go ahead to the next slide, that's great. The top concerns amongst LGBTQ plus students, which was also corroborated by counselors and professional administrative staff, that their top concerns include feelings of anxiety, depression, family concerns, which in their reports also include concerns of coming out to family members, difficulty coping with stress, academic performance, social isolation, and navigating multiple marginalized identities. That these issues rose to the top of the self-reported concerns amongst high school, college, and university LGBTQ plus students. Let's go to the next slide. Now, in the context of LGBTQ plus students' disproportionate mental health issues, it is critical to recognize that the majority of them want help and will seek assistance through informal or formal means. The Proud and Thriving survey found that nearly 3 in 4 LGBTQ plus students reported having a desire for professional counseling in the past 6 months. We also found that LGBTQ plus students actively sought help through multiple therapeutic outlets. They were open to therapy, they were engaged in help-seeking behaviors, and all of that at higher rates than their non-LGBTQ plus peers, which is great. Similarly, the HMS data that was looking at college students revealed that over 90% of LGBTQ plus college students said they would seek help from a clinician or informal resource should they need it. That is incredibly high and a great number. Last, 67% of the LGBTQ plus college students from that study had used therapy before, nearly twice the rate of their cisgender and or heterosexual peers. All of those are great positive help-seeking behaviors. Let's go to the next slide, please. We also looked at resource use. The college students, the high school students, they all recognized that there were multiple sources of information, of help that was available to them at school or on campus. And we have a list here of those that were most frequently listed, not in order of how frequent they were, but this is the general list so that people get a wide range or a wide understanding of what students see as resources to them. So that includes a school counselor, teacher, staff member, gender inclusive restrooms, support groups, student organizations, and so on. What's really helpful to also understand is when we disaggregated by race, the BIPOC LGBTQ plus students in the survey reported higher rates of participating in programs where they were mentored by other LGBTQ plus students and higher rates of using an LGBTQ plus centered library than their white LGBTQ plus counterparts. What's also helpful to know is that while the vast majority of students who use these resources found them helpful, less than half surveyed felt that their school less than half felt that their school provided sufficient support for students. So there's this interesting recognition of resources available, while also a very important reflection from the students that they don't feel like that is enough or sufficient for them to feel supported in their educational environment. Next slide, please. The students in our survey reported numerous barriers to treatment that we highlight here. Despite the existence of the services and the resources, there were many barriers that they identified that put them at a disadvantage when it came to getting the proper mental health support that they needed. Of the 3 and 4 LGBTQ students in the Proud and Thriving survey who reported to having a desire professional counseling in the past 6 months, less than half actually received it, which is why we wanted to enumerate what are these barriers so that you could be aware that even though you have services, there are things getting in the way of students getting the treatment that they want and need. The biggest barriers that stood in the way of getting help were the expenses or financial, time, not knowing where to go for treatment, fear of talking about mental health concerns, fear that counseling wouldn't work, not wishing to seek parental permission, which was significant for high school students. Same for high school students as not wanting virtual mental health care while at home, and fear of being outed. Overall, there was also concern of the stigma of receiving treatment, and for some students, not feeling like they had the need to, irrespective of any symptoms that they experienced, and a lack of health insurance. It is important to note that for many of these that you see up here that have the asterisks next to them, that BIPOC students were less likely than white students to seek or receive counseling due to these barriers. So we're looking at these as priorities of removing to help students get the treatment that they need. Let's go to the next slide, please. The Proud and Thriving survey found that more than 40% of counselors and administrators believe that they had not been adequately trained to support the needs of LGBTQ plus students. This is a really important thing to recognize, and the self-awareness that they had of what was missing. Now, nearly half of all administrators in the survey, and a lower number, but not insignificant, 14% of counselors rated their staff as not at all skilled to work with LGBTQ plus students, which is a stark and important piece of information. And it highlights a concerning competency gap between the perceived competencies of professionals and these two different roles. In addition to a reported lack of training and insufficient skill set, a small, but again, not insignificant set of counselors and administrators, 6% of counselors and 3% of administrators, admitted to harboring negative biases towards LGBTQ plus people. Now, I want to note that ideally, we would expect and need to see these percentages at 0. So 6 and 3% are actually large percentages. Now, data from the Pride and Thriving focus group illustrated the impact of the negative biases and cultural competency gaps on the well-being and safety of our LGBTQ plus students. They associated competency gaps with inadequate mental health services, mental health treatment that exacerbated LGBTQ plus students' mental health concerns, heterosexist, monosexist, and cissexist classroom instruction, scarcity of curricular representation of LGBTQ plus scholarship and topics, microaggressions and negative classroom environment, and absent, unclear, or inadequate policies and protocols that protected their rights. We'll go to the next slide, please. We also looked at the differences between high school and college experiences. These are significantly different developmental milestones for students at these ages, as well as there being a stark contrast in the number and variation of resources. We found that nearly all mental health and support services for LGBTQ plus students were more commonly found at colleges than in high school. So it is no surprise to us with these resource differentials, as well as the developmental differences of these age groups, that we found that LGBTQ plus high school students are faring much worse than college students. They reported having more emotional risk factors, less resilience, and greater concerns regarding difficulty with schoolwork, feeling unsafe, experiences of dead naming, religious and spiritual tension, and sexual assault than their college and university counterparts. Although LGBTQ high school students were perceived by counselors and administrators alike to have better family support than college students and to also have more positive adult role models in their lives, they were less receptive to seeking help due to fear of being outed, seeking parental permission, and the lack of comfort opening up to a counselor. The risks are just different and their experiences vary compared to college students. So correspondingly, more LGBTQ plus high school students reported thoughts of self-harm, actual harm, thoughts of suicide, suicide planning, and suicide attempts than their college counterparts. I will end my section with saying that the experiences of LGBTQ plus high school, college, and university students, keeping that in mind, it is also important to remember that schools and institutions can foster protective factors to buffer against and or reduce the psychological distress caused by a cis-sexist, heterosexist, and monosexist learning environment. And this project offers recommendations for how to do so. Thank you.
Thank you so much for that. Marin and Reese, this is important data and information. And I know when we hear some of the negative data, we feel like it's hopeless, but some of this is information for us to use to create those positive support systems. We received the question in the Q&A, a couple of them, about insurance. And we asked demographic questions in our survey, but I think in the report, we addressed the questions of insurance, so we won't address it here. Another question we received were questions like, what is dead naming? We use language like cis-sexism and several others. We actually have a page that it's in our current literature reviews that if you download, we have a page on language that addresses some of these words that we chose to use, which ones we chose not to use. So do you want to just describe, since we did get in the Q&A, what dead naming is?
Yes, dead naming is the experience that trans and non-binary students have where individuals refer to them as the name given to them at birth that they no longer use. And in many cases, it's when people know that that student is using a different name, their chosen name. So that's what dead naming is. Thank you.
Thank you for that. And again, we are just thrilled to have had so much information. It's really hard to put so much really great, rich data into a short report, which is what's taking us so long to try to condense it into digestible information that you can easily use and quote and share. So thank you for that. We're going to move over to the actual recommendations. So from all the data, what were some ways that we thought colleges and universities and high schools can help students? And we actually, you saw some of the data broken out by high school versus college. And we had some conversations about how do we create a set of recommendations that addresses these disparate populations, especially when it comes to age, parental involvement, some of the privacy legislation that we have to consider and policies within each institution. But I'm going to turn it over to my colleagues here at Jed who are going to go over the ones for individuals, the ones for mental health professionals, and recommendations for colleges, universities, and high schools. So John Dunkel is here and Emily Bader. So thank you for joining us and for sharing some of these recommendations on our behalf. Dr. John Dunkel. Oh, I'm sorry, Emily. I think Emily's first. Sorry, Emily. Emily, you're next, and then Dr. Dunkel. Thanks.
No problem. Thank you so much, Sophia, and thank you all for being here. My name is Emily Bader. I use she, her pronouns, and I'm here from the Jed Foundation. And I'm going to talk a little bit about recommendations for individuals. This can be for educators, caregivers, or anyone who wants to support LGBTQ plus young people in their life. So the first thing that's really important is to keep learning about LGBTQ plus needs, experiences, and intersections, and really ensure that you're doing your best to consume content made by or talking about the experiences of LGBTQ plus young people. The next recommendation is role modeling inclusive language and affirmative behaviors. So ensuring that you are sharing pronouns. And also we heard earlier from our presenters about affirming language. So ensuring that you are using affirming language and that you're also speaking out if you hear others who are using offensive language or inappropriate comments. Showing up for LGBTQ plus events, this is really crucial just to build trust in the communities and also, again, to learn about the lived experiences of LGBTQ plus young people. And then lastly, advocating for policies, programs, and resources that promote LGBTQ plus equity and inclusion. We heard from some of our presenters about bullying and harassment policies. So just really thinking about personally how you can advocate, and also in your classrooms, at work, really anywhere that you can offer your advocacy and make sure that LGBTQ plus young people are being included in policies and are also being advocated for in policies. So I'm going to hand it over to John, who's going to talk a little bit about recommendations for mental health practitioners.
Thank you, Emily, and thank you everyone on this project. I am John Dunkel. I am a cisgender gay man, and I say that up front because that process of myself navigating and integrating my gay aspect of self really played a big part in why I became a psychologist. And so this project is near and dear to my heart, and I'm very grateful to be able to play a small part in helping to come to fruition. I'm going to talk a little bit about recommendations for mental health practitioners. Some of the ones Emily mentioned apply to mental health practitioners. First and foremost, I think that mental health practitioners should view working with LGBTQ plus clients as a core competency that they need to develop. That they need to, first of all, read these two great literature reviews to learn what the risk and protective factors are. That's very important to learn about the language. There's some questions about the language. Why are pronouns important? All those things are really important in their development. Most mental health disciplines require by licensure that they develop these core competencies, and they also, their ethical codes do as well. So I think seeing it as a core competency is something that really I would recommend, and that's really what is suggested. Like I said, learning about the risk and protective factors. Implementing inclusive practices in your mental health practice is also very important. So the language that you use on your forms when students come in can be very important. Do you ask questions about pronouns, about gender identity, about sexual orientation, etc.? All those things can be very important. As a matter of fact, symbolism in general in one's office space can be very important. It can be it is a very private and lonely process at times for a young person starting the process of understanding their LGBTQ plus identity. And one thing they do, and I know this is true for myself, is I would scan the environment to see where it was safe. And I would look for signs. Is there an ally sticker in the office? How do they talk about LGBTQ plus identities? That's all really important when a young person comes to seek help from a mental health practitioner and wanting to know that it's a safe space. That's still important to me to this day at the age of 55, going around and into new environments and knowing how people view LGBTQ plus people. That's something that's important because I want to feel safe. And I don't feel safe, my mental health is going to be impacted, etc. Keep learning about the safe spaces where young people go and thinking about how you can reach them. They may not come to your office directly, so maybe you need to get out into the community. That's how you start to really, break down barriers and also to help build trust with students and with LGBTQ plus young people. So getting out there is really important. Understanding the resources that are available, both in the community and wherever they might be, is also really important. Understanding the developmental stages that a young person goes through in understanding their identity. And also supporting other staff to develop expertise in this area. That's really, really important for a mental health practitioner and for a student to feel safe. You can go to the next one. For colleges and universities, it's a very similar thing. And I worked in in high schools. I worked in a university for 25 years, so I know firsthand about this process where you really have to come from the top, and all staff, all faculty should be engaging in learning about LGBTQ plus identities, languages, experiences. Also setting the tone by, today we started out by mentioning our pronouns. That goes a long way, and it sends a strong message to someone who may be very uncertain. Revisiting, it's been mentioned earlier about programmatic and educational curriculum, et cetera. Supporting the openly LGBTQ plus teachers, faculty and staff and administrators. This is one I really want to stop real quickly and just say, this one is really critical. This was true for myself when I was coming out in the high school years in the early 80s in a very rural area in upstate New York, a small high school. I was starting to understand privately and very lonely what it meant to be gay, but I knew there were people in my school, they may not have said it, who were gay. Matter of fact, I reached out to one of the teachers a couple of years ago, and him and his husband, I met up with them, and I told them, I want to thank you for what you did for me. You didn't even know it. And they were just blown away by that. And as a matter of fact, the teacher said the principal at the time came to him several years later and said to him, thank you for teaching me about the LGBTQ plus identities and the importance. He said, thank you, you saved lives. That's very powerful. Role models like that, who young people see, who may not be able to say it themselves, but they see others out there, that can go a long way to help them feel safe, and in some ways help them save their lives. Attending the cultural and social events, that's really important. And like I said, to break down the barriers and help build up trust. When young people see you there consistently, they really know that you're really committed to this. You can go to the next slide. I'm not going to say too much here. Collecting and examining data, that's something that's really important to me. Really making data-informed decisions and then adjusting your policies, procedures, programs, and services accordingly based on trends. Having the resources available. Just having an office may not be enough. Make sure you have the staffing and the resource available to make sure that the infrastructure is there to support the young people. Again, prioritizing cultural competence for the faculty and staff in this area. That has to start from the top. And it can really send a strong message if it's really part of a strategic plan, part of expectations, even of job evaluations, performance evaluations. We talked about removing barriers to seeking and accessing mental health and other resources. That's really important for high schools. Offering training for family members and guardians so that they understand how to better understand and can support LGBTQ plus students. That's really rushed, but I just want to thank again the group for inviting me to be a part of this. So thank you.
Thank you so much to all my colleagues and to everyone who joined us today. We appreciate you because even you being interested in this topic for us means a lot, and it means a lot to our young people whose lives we're trying to save. So if you have, unfortunately, we were not able to answer too many of our questions. We did some in the chat and we also answered some out loud. But if you do have additional information that you need or questions, please feel free to email us at info@jedfoundation.org. Go to our website. A quick conclusion I want to say is, as you can see, this is not an easy topic. It's ongoing, and a lot of rich information is contained in our literature reviews and will be part of our final report, where you see some of that data drilled down a little bit and more detailed. So we hope that you do go to our website at the end of the month. We will send the message. As you can see, we will definitely send out messages on our social media, on our website, to make sure that you're able to download the final report. But in the meantime, please enjoy the information that we have provided in the literature reviews. If you want to join us in the future for any of our programs, please continue to join our website, join our listserv, so that you can continue to get our newsletters and invitations to webinars like this. So thank you very much for joining us. We appreciate it.